understands that our dependence on foreign oil and our dependence on the carbon-based economy is undermining our strength. We are exporting billions of dollars to regimes around the world that use our money against us. And now President Bush took a balanced budget and a surplus and has turned it into large deficits and a $9 trillion debt. We borrow money from the Chinese to buy oil from the Saudis. I don't think that's a smart strategy for America. So when I talk about a new energy future, it is about getting the cost of energy down, because nobody can continue to pay these high costs. We need to get more help for people in Maine to pay their heating bills right now. I have a plan to give everybody eligible in Maine, about 150,000 households, on the average of $650 to help you with those heating bills. Because until we get control over our energy future, we've got to help people be able to afford to pay what they have to pay at the gas pump and the utility bill. So we have to attack energy, because if we don't, our economy will continue to get weaker. Because the cost will drive jobs down and will put people on fixed incomes into very difficult positions. So I have advocated a strategic energy fund. I would take $50 billion and put it to work researching new forms of energy the way we did with the space race. And where would I get that money? I would take the tax subsidies away from the oil companies and impose a windfall. And there is so much we can do at the local level, and as we invest in clean energy, we will be creating green collar jobs. You've heard of white collar, you've heard of blue collar, well, here are green collar jobs. I am convinced that we can take a lot of, not all, but we can take a lot of, the pulp mills, the paper mills. They can start producing energy the old-fashioned way by using a renewable resource known as wood. We can actually put people back to work in a lot of the middle towns producing local energy. If we get serious, we can start connecting people up to a modern grid so that we can supply energy across a larger distance. This takes a commitment from the President of the United States, who can look at the map, just like previous presidents did. In the middle of the Civil War, Abraham Lincoln said, we're going to make sure that the Transcontinental Railroad is finished. During the Great Depression, people were out of work. President Roosevelt said, we're going to electrify America. During the 1950s, President Eisenhower said, we're going to have an interstate highway system. We need a president who looks at that map and says, we're going to have homegrown energy from Maine to California. Until the two oil men leave the White House, but as soon as put our construction workers back to work, fixing up America, rebuilding America, making it sure that we've got the infrastructure we need. We're going to end George Bush's war on science so that we can put our scientists and our researchers back to work. Committed to achieving universal health care. This is not an issue for me. This is where my heart is, because for 35 years I have worked as an advocate for poor children and families. I've been there in hospital rooms where somebody is told, I'm sorry, we can't afford to continue with your treatment. And I've had to scramble around trying to find some way to keep a child on a cancer treatment or to get the surgery that he or she needs. I've been there fighting the insurance companies when fathers and mothers come to me and say, what have I done wrong? I paid my premiums, we were healthy, and now all of a sudden my son is sick or my daughter needs a bone marrow transplant and the insurance company says we won't pay. So I've argued, and I've embarrassed, and I've pushed, and every so often they'll say, okay, fine, get me off their back. They'll say, okay, we'll pay for the operation. It should not take a United States Senator to get a mother or a father. Who is committed to universal health care. Because to me it's a core value. It is a human right. It is not a privilege. And it is long past time that the United States of America, the richest nation in the world, figured out how to provide quality, affordable health care for everyone. And here is what I think we should do. If you have health insurance that you are happy with, nothing changes. You keep the plan you have through your employer, through your union, however you have it. Nothing changes for Medicare. We're just going to make it better. We're going to get you more services. We're going to negotiate for lower drug prices. We're going to get the cost down by getting the drug companies to cut a deal with Medicare. But if you are uninsured, or you have insurance but it won't pay for what you need, here's what we'll do. Because you see, we have two problems. How many of you know somebody who's uninsured? And how many of you know somebody, maybe you yourselves, who have insurance except you can't get it to pay for what your doctor or the hospital says you need? See, we've got two problems. We hear a lot about the people who have no insurance, 47 million. But I estimate every year there are 30 or 40 million fighting with the insurance company, or their doctor is, or the hospital is on their behalf. So if you fall into those categories, which is a lot of Americans, we're going to open up the Congressional Health Plan. Congress has a good plan for itself, for its employees, and for federal employees. It has more than 250 options you can choose from. On average, they're cheaper than what you can buy in the open market or through your employer because you, the taxpayers, pay 75% of the cost. So I think if it's good enough for Congress, it is good enough for you. For people who have trouble affording it, we're going to provide healthcare tax credits. We're also going to limit the amount of money that anybody ever has to pay for their premium to a small percentage of your income. Because if everybody's in the system, that will help us get costs down. Every time somebody without insurance or who is denied their insurance coverage goes to the emergency room, they do get taken care of. And I see some nurses and doctors probably out there nodding their heads. We take care of people in America. But then the cost has to be spread to all the rest of us. It's like a hidden tax, because it doesn't evaporate. The hospital, the doctor, the nurses, we have to pay them. The equipment has to be, paid for. So all these people who get taken care of add to the base of the cost, and it keeps going up. And we've got to invest more in prevention, because what happens is people end up in the emergency room after they're already sick, after they've been chronically contending with a problem. It's more expensive to take care of them. And oh, please, let us finally provide the same care for mental health as we provide for Senator Obama and me, because he doesn't have a universal health care plan. Senator Edwards and I both introduced comprehensive universal health care plans. It's politically challenging to do that because, immediately the Republicans and the health insurance companies, they go after you because obviously they don't want any changes. But it was the right thing to do. And I was very proud that Senator Edwards and I really just decided to put ourselves on the line politically and say we're going to be focused on achieving universal health care. Senator Bobbin didn't, and he took a position that would leave at least 15 million people out, which will continue to drive up costs for everyone. Universal health care is a core Democratic value, and the Democratic Party needs to stand for the proposition that we will fight for the right of every person